Welcome to the MS-Perspektive podcast. Perspective with a K, as I'm German. I'm Nele Handwerker, MS patient, patient advocate and author. I'm bringing you interviews, inspiration and information about living with multiple sclerosis and show you ways how you can positively influence the disease and make the best out of your diagnosis. On ms-perspektive.com you will find the show notes, 11 free tips as a PDF and lots of other information. And now the show begins.
This podcast is supported by Mid-Mission, a project of the nonprofit Hertie Foundation.
Thanks for tuning in again and welcome to episode number 64, Navigating MS Treatment in Turkey with neurologist and associate professor Meral Seferoglu. Meral Seferoglu is working at the SBU Bursa Yüksek İntisas Training and Research Hospital in the Department of Neurology, and that is in Bursa in Turkey. So let's enjoy the interview. Hello Meral, it's such a pleasure to have you today on the show, and hello to Turkey.
Hello Nele, hi, thank you for your invitation. It's my pleasure to be here.
And it's my pleasure to have you on the show. Before we actually start with the interview, it would be lovely if you could introduce yourself to the audience so they know who is with me today on the show.
Thank you. First of all, before beginning to introduce myself, I want to say, while I saw your LinkedIn profile and this podcast series, I start to listen on my way to work, and congratulations for this effort, because I think that it touched many lives other than Germany, far from Germany. And I am a neurologist focusing on demyelinating disorders, and I'm married. I have 2 children, and also I have a cat. And I like especially walking in the nature and reading books, swimming and painting. These are my free time activities.
Fantastic. Sounds good. So we both have children, but I won't introduce your cat to my gerbils. That won't be a good match, I guess. So what was your personal motivation for your career choice, Meral?
So it is, I think it begins from my childhood, because I have always enjoyed helping people, and through my adulthood I see that becoming a doctor serves a good opportunity to help people in everyday life. You have a new opportunity to help people. And also, I can say neurology is a field that's with a great need in this aging population, and the developments are going on. And during my neurology residency, the constantly evolving literature and complex cases complete my excitement in this field. And after becoming a specialist, I have to go to mandatory service in eastern part of Turkey, and this was a big hospital also. And I was the only physician that served for young MS patients, and my story with MS began there. And when I return back to hospital that I am working now, I see that neurology doctors are doing well with other conditions, but they are somewhat staying distant with MS when it comes to MS. And I decide to establish an MS clinic in our hospital, and accelerated my training in MS-related studies. And now we have a small MS unit. We have outpatient clinic every day, inpatient clinic, and infusion room, and healthcare workers dedicated to their work. And I am really grateful to have these opportunities and advancement in my lifetime.
Fantastic, and thank you for all your efforts. It sounds really good. It's so important that MS patients are treated by specialists. So let's go a bit into the details of MS in Turkey. What is the prevalence of MS in Turkey, and how many people receive a new diagnosis each year?
There are 85 million people living in Turkey, and in the previous studies, we have different prevalence rates. It differs between 18 to 2088 in different regions of Turkey. But recently, one of our colleagues made a study from the health database of Turkey, and they found the prevalence as 96 per 100,000. And also the incidence was calculated as 6 per 100,000. And this we can say that we can say that 4,000, almost 5,000 people has the diagnosis of MS each year in Turkey.
Wow. Okay. So increasing numbers, and you are getting closer to us, I guess. I mean,
Yeah.
still away, but and hopefully it will stay that way. But maybe it's just because there were not too many specialists in the past. Who knows? How aware is the general population of multiple sclerosis in Turkey?
I think recently they are becoming more aware because of MS awareness campaigns and education efforts have been increased recently. I think in the last 10 years it's more than in the past. But it may still be relatively low to compare with prevalent health issues like hypertension, obesity, diabetes. In urban areas, among more educated segments of our country, the awareness is better than the rural areas, we can say, because of media, internet, and healthcare services they can search on. And every year, we are also organizing awareness programs during May, and we are sharing and also we make on the 30th of May, we make meetings with families, MS patients, healthcare professionals, and we are trying to include from other specialties like rheumatology, psychiatry, gynecology, urology to spread the word between healthcare workers also. It's very important because collaborative efforts involving healthcare professionals, patient advocacy groups, and also government initiatives can play a significant role in improving awareness levels over the country.
Absolutely, and I think that's a good way to go move on to the quality of life of MS patients. So, what are some of the challenges faced by MS patients in Turkey regarding access to healthcare and support services?
So I can say the MS patients in Turkey are lucky because our healthcare system is comprehensive and patient-centered, and patients can easily access hospital and physicians, and also they don't have problems to have the medications on the court. But there are more extensive healthcare hospitals in big cities, and reports of medications for MS patients are issued at these big hospitals, university hospitals, research hospitals. So in this context, patients from smaller cities sometimes may need to travel to these regions where the comprehensive hospitals are located. But I think that we learned many from COVID, and like everywhere in the world, the remote access system has been developed during COVID, and it seems that this process provides convenience in this regard. And I think in the next future, near future, I can say, the patients may have their routine checkup in local areas and prefer to visit large hospitals only in necessary situations, I think.
Sounds good. And I mean, that's what's happening sometimes here in Germany as well, that you go for the larger decisions or things like that to the really MS centers in the big cities, and you are treated by your neurologist nearby on the, let's say, during the normal things. when there is no important decision to be made. Which cultural stigmas or misconceptions exist surrounding MS in Turkey, or are there any at all?
Mhm. I think there are similar misconceptions about the disease nature. Like I hear that we are trying to educate patients about these misconceptions and stigmas, and they say that MS is a contagious disease, may lead to severe disability for all of them, and rarely, but it's not good to hear that they believe that MS is a barrier to pregnancy, and MS is a psychiatric disorder rather than neurologic disorder. This may cause people with MS being isolated from the community, and they are becoming more cautious in forming and maintaining relationship with others. And there are another stigma in the workplace, and we see that some MS patients lose their work or fired after diagnosed with MS. These are the things that we face here.
Yeah, okay. Sound familiar. And let's hope we can all work together on changing these misconceptions. And
I hope so.
I think we are doing a good job.
Yes.
So, how do cultural beliefs and attitudes affect the treatment and management of MS in Turkey?
Yes. The problem is about alternative or traditional treatments. I think, they may choose these treatments over conventional medical therapies, and these medicines are herbal medicine, acupuncture, homeopathy, hypnotherapy, as similar in other parts of the world, as we know. And there are some other treatments like hajamat and leech therapy that's used in Eastern culture, in Eastern part of the world. And this makes people to get late effective treatment therapies, and make the disease course worse. And we always ask to patients if they are adherent to the treatment we gave. They can use some of them, yes, but they have to tell us what they are doing in together with our advice. And also, the cultural beliefs about illness and disability can influence level of support they are receiving from their families and communities. And in our culture, the family is very important and supportive, we can say.
Yeah. Yes, we just had a session in the multiple sclerosis management program on the additional therapies. And if it's additional and not doing any harm, it's okay. If it's instead of the well-working evidence-based medicines, then it's really an issue. So let's talk about the access to treatment and support services. What types of MS treatments, therapies, or interventions are more commonly recommended or accessible in Turkey? And so what is about autologous hematopoietic stem cell therapy and things like rehabilitation?
Like in our country, it's possible to access many treatment options, prednisolone and plasmapheresis for relapse treatment. And when we come to disease-modifying therapies, administered stepwise because of health regulations. And we have first-line therapies include interferons, glatiramer, teriflunomide, and dimethyl fumarate. And second-line therapies include fingolimod, cladribine, natalizumab, and ocrelizumab. And the third-line therapies include ocrelizumab and alemtuzumab. And I know that stem cell therapy is applied in a few centers, but not in our center. We need special approval from the health regulations for stem cell therapy. And we are waiting for siponimod and ofatumumab in a few months in our country, I think.
Okay, sounds good. Sounds like you have more or less the full availability and just a little bit, you are a little bit behind with the newer treatments, but I mean, that's okay. Are there any specific laws or regulations in Turkey that protect the rights and promote the well-being of individuals living with MS?
Yes. I think the big chance is all the treatments are covered by government. This is a big chance. Yes. And our healthcare system is comprehensive. These are good. And the MS patients generally do not face issues accessing treatment, like as I told. And additionally, young male persons diagnosed with MS before the age 20, they are exempt from obligatory military service. This is a chance for them. And our healthcare system provides the opportunity to benefit 90 days of physical therapy each year in inpatient clinic. And also municipal services in many cities offer MS patient associations to the right to use social facilities. Like in Bursa, they can use the swimming pools, gyms for free on certain days and hours of the week. And sometimes they also provide discounted fares on public transportation. There are some benefits.
Great. That's really lovely. That sounds like here and even sometimes better. That's good. I really like that. So how do MS patients in Turkey cope with the challenges of living with the condition?
The family support is important. Also, the MS associations, patient associations play a key role providing social support. Also, almost all the associations in Turkey have MS specialists, doctors, nurses, physiotherapists, psychologists as a member of these associations, and they are having a active role in these associations and events. And these are good support. And also I know that social media accounts and pages of MS patients, and having also MS special centers is a good condition for MS patients. And these are make easy for MS patients to cope with the challenge, I think.
Great. What role do social support networks and community resources play in supporting MS patients in Turkey? I mean, you mentioned already quite some.
Yeah, they have a huge positive effect on public awareness. And also in these activities, patients can share their experience, and they can give advice to each other and encouragement. And these activities help them feel less isolated, and efforts to increase this public awareness help to reduce stigma and misconceptions also.
Great, fantastic. How have healthcare providers in Turkey adapted MS management strategies to better align with cultural norms and preferences?
I think they are good. They know their culture, and they recognized in Turkey that the importance of educating patients and their families about MS, like visible symptoms, invisible symptoms, and treatment options and management strategies. This make easy to understand the disease course and how they can best support their loved ones. And the healthcare providers also take a holistic approach, not only physical aspect of MS, but also the social, emotional, and spiritual aspect for these individuals and families. And I think family plays a key role in Turkish culture, though this when you include the family into decision-making process and support. It making it easy. Yes.
Great. So, Meral, we have another thing in common. We are both studying multiple sclerosis management master program. You study in English. We sometimes have lectures together. I study it in German. Why did you choose the multiple sclerosis management master's program that is offered by the Charcot Foundation?
Yes, I am very grateful to have this opportunity into being in this program, and I met new people, and I like all of them, as you also. And it has been always very important for me to adapt international evidence-based practices to fit the cultural context and preferences of Turkish MS population. This is the main thing, I think. And therefore, I thought the MS Master Program is a great opportunity, and this is what I see, and happened just as I thought.
Yes. What new or in-depth things have you already learned about multiple sclerosis that will benefit your patients?
Yeah. So I had the opportunity to observe that the knowledge is universal and our patients are treated under similar conditions as other countries. And explaining the situation to patients firsthand is very reassuring, because they have always questions in their mind that if they are having the best option, the best treatment options, when you tell them that in the first hand that they are under the similar conditions as others, they appreciate. And the patients also express their pleasure in learning about my observation in such a comprehensive and international program. And also we have on-site programs in Dresden, Barcelona, and Milan. These are big MS care centers in works multidisciplinary. And in this program, you can see what you have and what you can do, and how you can think about how to organize your system to the best.
Yes, and there's happening so much in MS. I just was talking to somebody how much happens in just 1 year, because so many scientific specialists are concentrating on MS, and so many doctors, and so it's really moving forward. So I think it's just great.
Yeah.
So how do you benefit from the international exchange with lecturers and other study participants?
So it's really amazing to have interactive classes with world-renowned scientists, researchers, physicians on MS, and it's a really rewarding experience, I think. And the international program includes participants from other nations such as Colombia, Germany, Belgium, Italy, and the organization also comprise not only physicians but also other specialties like you as biologists, researchers, psychologists, and you have the chance to look MS with other viewpoints and to discuss the MS with other aspects. And also we have a cultivated deep and warm relationship. We miss each other when we see on-site programs. Yes.
Yes, absolutely. I mean, I had that in my former jobs, that I was traveling to Asia and even 2 times to Turkey. And I think the exchange is always so valuable, and it helps because it gives you different ideas of, I don't know, how you could explain something, or just make people aware of how lucky they are that they get the treatment or whatsoever. There are so many different points, and it always helps to get an outside view from the other people you are studying with.
Exactly.
So let's come to the quickfire Q&A session. Complete the sentence. For me, multiple sclerosis is?
For me, multiple sclerosis is an act of life, serves an opportunity for resilience and growth through the challenge.
It's a very positive look on it. I like it. What development would you like to see in the field of multiple sclerosis in the next 5 years?
I am expecting much. And I would like to see significant advancements in MS research and treatment options. Specifically, I hope for personalized medicine approach and improved symptom management, especially fatigue and cognition, and new reliable biomarkers that are non-invasive, cheap, and available everywhere. And regenerative therapy is also another topic. But the most important thing, I want the care to be equal, enhanced access to all over the world for all of MS patients, and increasing the empowerment and involvement of MS patients in this course.
Yes, very lovely wishes, and I hope they will come true in the next 5 years. Finally, what message of hope or encouragement would you like to share with individuals living with MS in Turkey?
So I want to say, dear MS patients, I wish for you to spend each day with hope and strength, because MS may present challenge. Yes, we know that, but we should remember that your resilience and determination are greater, and together with solidarity, we can overcome every difficulty. And I advise to look to the future with hope, because, as we talk, science and support are advancing each day. And dear MS patients, you are strong and you are valuable.
Thank you very much. And yes, that's a very lovely statement. How and where can interested people follow your research activities, Meral?
Okay, I have an Instagram and LinkedIn account. I always use LinkedIn for my research, and also with our MS hospital team, Bursa MS takımı, Bursa MS team, we have an Instagram page for MS patients known as MS Yolculuğum, where we make announcements locally what we do, and I welcome everyone who joins and collaborate.
Fantastic. And of course, I will link both accounts. So the LinkedIn one, where I always see you, and the Instagram one, which I was not aware of until today. And thank you very much for giving us that inside view into living with MS in Turkey and treatment, of course. And it's really great to hear that so much things are already existing. And of course, there is more and better things to come, I guess, in the future for all MS patients worldwide. So thank you very much. And I hope to meet you maybe at one point at an extrems. I think this one, the upcoming one, I won't join due to my little baby, but maybe then the one in 2025.
So
maybe you are going there as well.
I am looking forward to see you. Yes.
Thank you, Meral. Bye-bye.
Bye-bye.
I hope you enjoyed the interview and learned something new about how treatment in Turkey is happening and where you can find support. By the way, next time I will be talking about another disease-modifying treatment or immunotherapy, and this time it will be on glatiramer acetate, which is known under the brand names of Copaxone, Clift, and Bravio. So please tune in again and stay as healthy as possible, and see you next time. Thank you for listening today. I hope you found it helpful. You may also be interested in the previously published episodes and posts, which you can find at ms-perspektive.com/podcast. Perspective with a K. You can also get a free PDF with 11 tips for your positive impact on MS at ms-perspektive.com/newsletter. If you'd like to get in touch, you can reach me at nele@ms-perspektive.com or on social media. See you next time.